data is this kind of great passion area for you. Talk to us a little bit about IT and data specific to healthcare and some of the learning that you've encountered around that over the course of your entrepreneurial journey.
I've had a chance to be part of very exciting projects in machine learning AI, do a lot of seminal work in the field in tech outside of healthcare. And when I came into healthcare, my sort of the fundamental questions we started asking is, healthcare data are far more messy than the typical data we see in other fields. How are we going to take AI, adapt AI, push the technology to be able to work in field like healthcare to be able to produce like results that are trustworthy, that physicians will adopt, right? Like clinicians will adopt. And that's really where the bulk of my focus has been. And what's been really exciting to me is watching in a mere period of 10 years, how we've gone from what I would consider no data in the sense of paper records to be able to have the EMR, data and infrastructure layer. John, you were very instrumental in making this happen. But literally now we have one of the most exciting infrastructure layers where the data now exists as digital, and we can really leverage this infrastructure layer to solve the core problems in healthcare. Something that is, there are just so many transformative possibilities from here on the clinical front, administrative front, cutting unnecessary waste, improving efficiency, improving outcomes. So I think the next 10 years is going to be the most exciting time in healthcare from an innovation standpoint. And the coolest part of it all I see is moving from the past 10 years where there was a little bit of like anxiety around technology not being necessarily helpful, but maybe sometimes being painful. But that's almost always true. When you try to do something new, there's a period of settling in, understanding, and getting used to the infrastructure.